Have you ever wondered what happens behind the closed doors of an intensive care unit? Let's explore the critical role these specialized departments play in saving lives. Inside the ICU, where advanced care saves lives. Let's recap the key points about intensive care units. ICUs are specialized hospital departments providing round-the-clock care for critically ill patients, equipped with advanced medical technology and staffed by highly trained professionals. They utilize continuous monitoring systems, ventilators, smart infusion pumps, and dialysis machines to provide comprehensive care for patients with life-threatening conditions. ICUs employ complex protocols for patient care, including specialized treatments for sepsis, advanced hemodynamic monitoring, and neurocritical care, significantly improving outcomes for the most severely ill patients. The Intensive Care Unit, ICU, represents the pinnacle of hospital-based critical care, utilizing advanced medical technology and specialized staff to treat the most severely ill or injured patients. Let's delve deeper into the intricate workings of an ICU. At the heart of ICU operations is the concept of continuous monitoring. Each patient is connected to sophisticated monitoring devices that provide real-time data on vital signs. These include multi-parameter monitors that track heart rate, blood pressure, respiratory rate, oxygen saturation, and body temperature simultaneously. Ventilators, a crucial piece of ICU equipment, come in various modes to support different patient needs. These can range from full mechanical ventilation for patients unable to breathe on their own, to non-invasive ventilation methods like BiPAP, bi-level positive airway pressure, for those requiring less intensive respiratory support. Intravenous infusion pumps in the ICU are programmable devices that deliver precise amounts of medications and fluids. These smart pumps often have built-in drug libraries and safety features to prevent medication errors, a critical aspect of patient safety in such a high-stakes environment. For patients with kidney failure, continuous renal replacement therapy, CRRT machines provide 24/7 dialysis. Unlike intermittent hemodialysis, CRRT allows for gentler fluid and waste removal, which is often better tolerated by critically ill patients with unstable blood pressures. The ICU team employs complex protocols for patient care. For instance, the management of sepsis, a life-threatening response to infection, involves a time-sensitive bundle of interventions, including rapid administration of antibiotics, fluid resuscitation, and vasopressor medications if needed. Intensivists, the physicians specializing in critical care, often use advanced hemodynamic monitoring techniques like pulmonary artery catheterization or echocardiography to guide fluid and medication management in patients with complex cardiovascular issues. Neurocritical care in the ICU involves specialized monitoring for patients with severe neurological conditions. This can include intracranial pressure monitoring for traumatic brain injury patients, or continuous EEG monitoring for those at risk of seizures. Infection control is paramount in the ICU due to the vulnerability of its patients. Strict protocols are followed, including the use of personal protective equipment, regular hand hygiene, and isolation precautions for patients with communicable diseases. The ICU also employs advanced nutritional support strategies. This may involve parenteral nutrition delivered directly into the bloodstream for patients unable to use their gastrointestinal tract, or specialized enteral feeding formulas for those who can be fed through a tube. Lastly, modern ICUs are increasingly incorporating telemedicine capabilities, allowing for remote consultation with specialists and providing additional support to the bedside team, especially in rural or understaffed settings. Thank you for watching our in-depth exploration of intensive care units. We hope this video has given you a deeper understanding of the critical role ICUs play in modern healthcare.